I'm a little overwhelmed by these numbers this morning. Did you know there are 27 million people in the U.S. that suffer from type 2 diabetes and another 86 million that have prediabetes, where their blood glucose is not normal but not high enough to be diabetic yet? Well, here to educate us on diabetes is Dr. Kyle Longo with Empower Health. Good morning, sir. Thank you for coming in.
Thanks for having me.
So tell us a little bit about yourself first and your background.
Well, I'm a St. Louisan, born here, raised here. I went away for undergrad, then came back and went to Logan College of Chiropractic, where I graduated, and have been practicing for over a decade now, spending most of my efforts in a field called functional endocrinology, which is now called functional medicine. It's taken on a new term, and I guess you could say my efforts have been focused, to a large degree anyway, on treating diabetes, helping people to reverse diabetes.
Well, and I read that. You and I had a little talk here before we went on, and I was so overwhelmed by those numbers and this pre-diabetes, and I thought to myself, if I'm pre-diabetic, if my glucose numbers are high or abnormal, am I automatically going to become diabetic? And you said, no, that's not necessarily the case.
That's not necessarily the case.
It doesn't have to be anyway.
Exactly. There are a couple very big misconceptions in the general public right now, and one is if you're pre-diabetic, then it's inevitable you'll become diabetic, and that's not true. Pre-diabetes is very easily reversible. In basically all cases, pre-diabetes is reversible and you don't have to become diabetic. The second is that once you are diabetic, type 2 diabetes we're talking about, that there's nothing that can be done at that point, that you'll simply need to manage the disease or hope that you don't suffer a complication, and that's not true either. Type 2 diabetes is very often reversible as well.
What is your approach to that then?
Well, that's the key. You have to take a different approach from what most people do. Most medications, really all medications, and the traditional approach focuses simply on lowering blood sugar. Blood sugar is a symptom or an effect of insulin resistance. So imagine in any health scenario, if you focus on the symptoms, not the effects, the problem persists. And so when you try to manage diabetes by managing blood sugar through medications, or a lot of times patients come in and they're frustrated because they don't diet and exercise and weight loss, and yet here they still are, not feeling well, still sick, and it's because the focus has been on blood sugar symptom versus insulin resistance, which is the cause. So obviously our office focuses on insulin resistance, the cause.
So how can someone find out if they're pre-diabetic?
Well, simple tests can tell you whether or not you're pre-diabetic or diabetic. The testing to determine where you are on the spectrum and how easily it could be reversed or what would need to be done reversed is different from the traditional testing. And so we need to combine doing basic lab work with some other more advanced testing to be able to determine, hey, can you be helped or not? How long might it take? Where are you in this continuum or the spectrum of the disease?
If somebody's curious, what would your advice be if they want to know how they stand?
Well, it's pretty simple. I would say come into my office and let me check you out. Right? We need to have a discussion. I can tell quite a bit, usually just from a consultation, and then we'll go forward and we'll do the testing that needs to be done so that I can get answers. Truthfully, I don't know whether or not I can help someone until after I get the results of those tests back. At that
Better
point,
to know, though. I mean, and without the testing, you don't know.
The worst thing is just let yourself keep going down the same path.
Dr. Longo, thank you so much. Appreciate you being here today. Empower Health is located in Creve Coeur on Ballas Road. Right now, Dr. Longo is offering a consultation exam and testing for $39 to the first 25 callers, and they can also register on the website. The number is there on your screen right now, 314-778-3222, and the website is diabetesstl.com.